Hi, we're live with this episode of Women Talk. We are so excited to be bringing our guests here today. We welcome Dr. Hawkins and Shahela DeFiels. Thank you so much for joining us today, ladies. This is such an important topic, and we are so happy to have you with us.
Thank you so much for having us.
Yes,
Yes,
thank
of
you for having
course.
me.
Thank you so much for sharing your time and your expertise with our audience. Today's episode of Women Talk, we are partnering with the White Dress Project. We're so excited about that to talk about fibroids. So, did you know that the vast majority of women will get uterine fibroids by age 50? Today, we'll be learning about the healthcare barriers and the treatment options and discuss the steps that you can take to manage life with fibroids. So first, let's bring up our first question. Our first question is for you, Dr. Hawkins. Thanks to medical advances and more treatment options have become available for people dealing with fibroids. Dr. Hawkins, can you share your approach to treatment options with your patients?
Absolutely. So first, let's talk about what fibroids are. So fibroids, by all definitions, are benign tumors of the uterus. And I make a mention to say benign because I think it alarms many women to hear tumors and they think automatically it's cancer. They grow from the cells of the uterus, and they, like you said, can appear in 70 to 80% of women with a reproductive age, period. So that's a great majority of us that may have fibroids. They're not always symptomatic, but can be. And to answer your approach about what we go over as far as treatment options, a lot of the options depend on those symptoms. Are they having heavy menstrual bleeding? Are they having any pain or discomfort? Do they have a desire for fertility? All of those things have to be weighed into discussing options. And the great thing about advancements in medicine and technology is that there's a plethora of options that are available now for fibroid management. There are medication options as well as surgical options, non-surgical options. And there's a thing called observation that's available too.
Great. And Dr. Hawkins, I now pass it over to Beth for our second question. Thank you so much.
Hi, thanks, Jana, for jumping in there. I had a little bit of a glitch. So Shay, question for you. Can you share with us your fibroid journey and tell us about any barriers to treatment or care that you faced?
Yes, I got diagnosed with fibroids while I was in the Air Force Reserves, and I was getting a routine ultrasound with my last kid, and they played it off like it was nothing. It was like, oh, there's a fibroid there. And I was like, okay, what is a fibroid? And he was like, it's nothing to worry about. It happens in Black women, it'll go away. So I didn't think anything of it. Um, about 5 years ago, when I moved to San Antonio, um, I went to the doctor to see if I can get an ablation done because my cycles were starting to get heavy.
Okay.
And when I talked to her immediately, instead of asking why I wanted the ablation, she was saying, well, cancer is common in Black women and cancer this. And she immediately diagnosed me with cancer. And I was like, I can't do this. So I went and got another opinion. And it was like, well, let us do an ultrasound first to see what's going on. And that's how they found the fibroids. They measured them at the time. My biggest one was the size of they said a small grapefruit.
Okay.
And by that time, the symptoms started getting more and more, like my cycles were heavier. I'm more lethargic between day 3 and 4 because it lasts 7. Um, like I can't leave the house. I can't move. And they've grown over time.
So your fibroids, you started noticing the symptoms, like your bleeding during your monthly cycle became heavier, and then to the point where it was affecting your daily activities. Is that what? Yeah.
Yes, because me having 3 kids, for whatever reason, I don't feel contractions. So I don't have menstrual pains. I don't have stomach pains. I don't have any. I never did up until I found out about the fibroids. And I'm like, something's going on because that wasn't there before. And the more the symptoms start going in, I knew something was wrong.
Wow. Okay. I always like to hear like what are some of the symptoms people are have experienced. And Dr. Hawkins, what are some of the considerations that patients should think about when determining a course of treatment, especially if you desire to have a baby or more babies?
Yeah. So it's extremely important to consider one, the reality of where your fibroids are at the moment, because sometimes your options will change over time. A lot of times they will. And also, your options are going to be based on location of the fibroids, especially when it comes to preservation of fertility or optimizing your ability to conceive and carry a pregnancy healthy with or without fibroids, because it can be done even with fibroids in place. So, when patients are considering their options and they want to keep their fertility intact, if the fibroids are located closer to the cavity, which is the same place we menstruate from, but also the same place the baby needs to live, then they want to always make sure that those fibroids are 100% taken care of, if at all possible. And the way that they're taken care of, again, is going to preserve their fertility, preserve their uterus, and also make it as healthy and as strong as possible. Sometimes the other thing that they have to consider is, do they need to have fibroid surgery now? I don't think we talk about that a lot. A lot of people will assume once they have the diagnosis that fibroid surgery is inevitable and quickly. That's not always the case, because sometimes when younger patients, I'll have a conversation with them about the symptomatology, how significant and how large their fibroids are, how it's affecting their life and their well-being. Put that first. But if they're actually gracefully living with their fibroids, sometimes the discussion needs to be, should we wait to do something like a myomectomy, which is removing the fibroid and leaving the uterus, a little bit later when you're closer to that family planning time of your life, because there's a recurrence of fibroids. So if we do something now and you don't want to have children for 5, 6, 8, 10 years, there's a chance we might be taking that. We have to talk about doing something again before you even have your first child. So there's a lot that goes into the equation. And like we talked about before with those options, the location matters, the symptoms matter, the goals of the patient matter, and what they want to do with their fertility absolutely matters.
Such great information. And I know that there are so many women that are struggling right now. And even for me, I was diagnosed with fibroids, and the first doctor I saw said, you know what, you're going to have a procedure before you start thinking about having kids. And then I went to a second doctor for his opinion, and he said, where the location is, you don't have to worry about it. So it is really important to understand options and making sure that you go to the right healthcare provider for direction and input, right? And this leads me to my next question, because there are so many women that are living in rural communities right now who are uninsured or underinsured, and they often have to travel long distances to get to the nearest provider. And in addition, there is a shortage of healthcare providers in these areas, and many are not specialized or experienced like you are, Dr. Hawkins, in minimally invasive procedures. And so as a result, hysterectomy continues to be one of the only options offered in these communities. What are some of your recommendations for women who are facing these challenges?
Yeah, so one of the recommendations I would make is to, if at all possible, tap into your resources. And resources could simply be friends and family who are maybe able to help you travel or find and seek out physicians that are specialized in fibroids like myself. It may be tapping into government resources or funding even. And one thing that patients don't know is that a lot of hospitals, like my hospital, Northside Hospital, they actually have to write off $3 million every year, and they give out a lot of free healthcare. So I do a lot of free surgery throughout the year. And simply the patients just have to fill out a financial application and bam, they're 100% covered for their MRI, for their visit with me, for all of our surgical expenses. I was a poor doctor when I had my second child, and my hospital paid for my entire delivery. That $8,000 bill they gave me, they wrote the whole thing off. All I had to do was ask. And a lot of patients don't know that. That is a resource. and gets them closer to the type of care that they desire and deserve. So they can see a specialist like myself. I'm a minimally invasive gynecological surgeon, meaning that I did a 2-year fellowship where I basically did nothing but surgery for 4 out of 5 days a week. And I got very good in complex cases and laparoscopic and robotic. So I'm able to offer women less invasive ways for them to get things taken care of and heal faster and get back to life faster. There's probably one of me in every major city, at least one or two. I wish there were more, but I think having a way to get access to specialists and for patients that are in these rural communities is something that, is unfortunately a problem, but knowing and tapping into resources will help a lot of women be able to do so, hopefully more easily.
Such great information. And, and I think it's really important to highlight that there are hospital systems that do offer this. So all we have to do is ask. So great message for our audience. So thank you for sharing that. And I can tell you, if you were in my zip code, I would be your patient for sure. So question number 5, Shay. Medical gaslighting is such a prevalent issue, especially when it comes to minority populations. What are ways that patients can advocate for themselves to get the optimal treatment and care that they deserve?
I would say speak up. I'm on doctor number 4 now, and I've always only been offered a hysterectomy. It wasn't until I got online and saw the White Coat Project and saw other women's stories, and they were saying they had myomectomies and other less invasive things done to help them. And my last doctor that I saw, she literally told me, and I was looking for her all over. She told me when she did see me, she said, like, by now, my biggest fibroid is the size of a grapefruit. Like, you can see it, you can see it. Especially when I lay down, I'm a very small woman. She told me, oh, you can live with it. She's like, if it's not bothering you or if painful or anything, she's like, you don't need a surgery. And I'm like, she's not listening to me. Like, it's affecting my daily life. Like, I can't leave my house after certain days. I'm always on iron medication because of the anemia. And now I'm on a hunt for another doctor. So I would tell people, speak up, make them hear you. And if they're not willing to listen, seek another opinion.
Really great advice. I couldn't agree more about seeking the second opinion and just using that gut instinct that we all have. So we're getting some questions in from the audience. And so I'm going to ask, I'm going to take the questions right now. Let's see here. Question 1 came from Kate. Can you talk a little bit more about the financial aspects of living with fibroids? And I'll pass that question up to both of you. So, Dr. Hawkins, do you want to kick us off a little bit about the financial aspects of living with fibroids?
Yeah, the economical impact of fibroids, this is a staggering number when I first read it, is about 31 million a year. And that's going to account for things like the menstrual pads that we buy every month. I have patients that come in, they're like, I literally use the entire pack in the first 3 days of my cycle. And could you imagine, how that cost adds up over time? The missed days of work and productivity, right? There's a lot of women that aren't even able to advance in their positions because they're not being given the raises or the opportunities because they're missing days because of their cycle, or their fibroids are causing them to be, have problems with their functionality when they are at work. That's the hospitalizations, that's the blood transfusions. There's a huge economical impact, not just even on the microscopic individual base, but worldwide. This is a pandemic, and fibroids finally is making some noise because numbers and money talks. And so we're seeing legislature around making moves and getting some information that maybe can help. And a part of that, Kate, is because of its economical impact. It's huge. It's more than a lot of cancers put together.
It's unbelievable when you put it in those kind of terms that it's more, more impactful than cancer altogether. So next question is going to come from Megan. What are some of the ways that women can be true partners in making medical decisions about their providers, with their providers? Sorry. Women can be, and what are some of the ways that women can be true partners in making medical decisions with their providers? Shay, do you want us to give us some examples of what you're doing right now to make sure that you're a partner as you're working with your healthcare providers?
I'm just making sure that I find somebody that's willing to help me and fit me. It's kind of limited. It depends on, your insurance and everything. So I have to be considerate of who I choose. But yeah, I would find doctors that's more catered towards what I'm looking for, that specializes in fibroids and the surgeries and different options. Like they have to specialize in that. Yeah.
No, that's great. And Dr. Hawkins, what would your advice be to women that are seeking out maybe that second opinion or have just heard about their diagnosis? How can they work with someone like you to make that best decision or that best decision on treatment options? Any
Sure.
advice?
Absolutely. So I am not one of those doctors that are like, don't Google, don't come in here with a list of questions, because I actually think it's quite healthy. I'm not a pediatrician. If something's going on with my child, you best believe I'm Googling it first. You know what I mean? Then I'm making that call. So I think it's very healthy for patients to arm themselves with some information. Even maybe you read about Acessa laparoscopic radiofrequency ablation and you walk through the door and you're like, what's that? I think that even gives you a leg up a lot of times in going into a physician's office, because if the doctor doesn't know about it, now they have no choice to either learn about it so they can get you the information you need or send you to someone that is going to be able to offer you more options than just what they can do. Because one of the reasons hysterectomy rates are so high is because that's the bread and butter for us. It's the first thing we learn in school and training. And if that's all we ever learned how to do, that's all that particular doctor is able to offer their patient. But it's not the only option for fibroids. Short of cancer, it's never the only option. Sometimes it's the best option at the end of the day, but it's not the only option that we should be able to offer. So go in there armed with some Google research and some information and question your doctors and get your questions answered.
I love that. And the White Dress Project has great information, and healthywomen.org is another great resource for you to kind of prepare yourself and go in with some really important questions. Caroline, asks, what is the likelihood that my fibroids will come back after treatment? Dr. Hawkins?
Yeah, so the actual statistics are a bit wide. It depends on the source that you're reading. Some sources will say 20%. You have sources that will say up to 60%. And sometimes that's influenced by a couple of different scenarios, like how many fibroids did you have at the time of a procedure? Was it 1 or was it 20? That makes a difference. We know that patients that have singular 1 fibroids have less of a risk of recurrence than someone that has multiple fibroids. But also, was your surgery done completely, especially if you had something like a myomectomy or Acessa or UFE where they're targeting fibroids? Did all of the fibroids get treated? Because fibroids all start off as rice size. So if we're leaving small fibroids when we do those procedures, those fibroids are going to grow. They're going to become potentially grapefruit size, like Shahella's, over time. So relieving small fibroids behind that increases your risk of recurrence too.
Good information to know. Our next question is from Thais. What recommendations do you have on how to find a fibroid specialist? Dr. Hawkins?
Google, again, is a good resource. I think that if your GYN doctor, your primary GYN doctor, or even your PCP has your best interests at heart, they'll also help you find a specialist and get that second opinion. I'm sending my patients back, so I'm not taking GYN work away from anyone. So I get a lot of referrals from my community physicians because they know I'm here and I'm for the community. So asking, I don't, don't be afraid. Don't feel like they're going to feel like you're cheating on them. If they have your best interest at heart, they'll help you find specialists like myself. And then I am a part of AAGL, which is an organization, American Association for Gynecological Laparoscopists. If you go on their site, you can find out maybe who's closest to you. And then the resources that we've already named today, like the White Dress Projects. I see patients all the time on the Instagram page saying, I live in St. Louis. Who's here? Who's had surgery? What doctor did you go to? How were you treated? What did their reviews look like? And women are popping up left and right and sharing their stories and giving recommendations. So again, tapping into the resources can help you find these specialists.
I love it. And I love the sharing now. And that's the positive thing about social media, right? Is that we are able to pop on and share, good experiences and resources and connecting. So that's the positive use of social media. And another question from Cynthia, do fibroids tend to get better or worse as you age? So as you think about perimenopause, menopause, and postmenopause, special considerations, and many of our audience are women that are 35 plus. So can you share like the journey of aging and fibroids?
Yeah. So pathophysiologically, meaning like what's the real root cause of this thing? It's hormones. Hormones are what make fibroids grow. Hormones are what make fibroids even symptomatic. So as we get older, as we get into our 30s and 40s, we get more women that are diagnosed with fibroids because as they get older, there's more opportunities to find them, right? So you'll read that we find more fibroids in 40-year-olds. It's not because it wasn't there when they were 20 and 30. It's just that it might have taken them 7 years to get diagnosed. But what does happen is patients that are older that get treatment, they have less risk now of recurrence as they get older because their hormones are starting to go down some. And as they cross over into menopause, fibroids can even start to shrink. Symptomatology usually improves. And all of that has to do with that hormone influence. So fibroids usually will get better. To very specifically answer your questions, they usually will get better after menopause. If your fibroids are getting worse after menopause, if you're getting more pain, more discomfort, if your bleeding is still kind of all over the place, unfortunately, those are potential red flags, and you do need to get those looked into. Fibroids are benign, but there is something called a sarcoma, which is cancer, and they can live together, unfortunately, but it's extremely rare. I don't want our audience to have anxiety about that, but certainly in that population of women, as we get older, unfortunately, our cancer risk in general increases. So that could be a red flag. Get it checked out if it's getting worse after menopause.
And then what about imaging? So once you're diagnosed with a fibroid, how often do you recommend that patients get imaging done to like check on whether the fibroid's growing or not? If women decide like, okay, you have a patient that says, you say, the fibroids are small right now, we're just going to, there's nothing that we need to do immediately, but how often do they need to have their fibroids checked, or what are your thoughts on that?
Most of us would recommend once a year, at least. If they're of a considerable size, but we're still choosing observation for the plethora of reasons we've already discussed. Initially, after diagnosis, I might get it at 6 months just to see, is there any rapid growth or change? Will this change your options? But at least once a year, because the options usually do change as they get bigger. So sometimes there's a critical point to intervene, not always because of symptoms, but because of size. Like how Shahela said, hers is, it's big. So yeah, we might not want to wait until it gets so big that she has to be cut open. Maybe now we can do something laparoscopically. And like I said, we have ways to shrink fibroids, but if your uterus is too big, then you're starting to lose some of those options even. Thankfully, with technology, we can treat smaller fibroids when they start to cause symptoms in the hopes that they don't get worse or too much worse over time. So the imaging helps us make those critical decisions as we go through the fibroid journey. So at least once a year, and then sometimes every 6 months if we're looking to make some decisions, and if your symptoms change.
That's the important part of it too, if your symptoms change. So if you feel like they're getting worse or they're affecting your daily, your daily living routine, you may need to go in sooner. Such great advice, Dr. Hawkins and Shay. Thank you so much for sharing your personal story, which is going to help so many other women that are listening today. Ladies, thank you for joining Women Talk. It's truly a pleasure to have you on our show. And for our audience, thank you for joining us today for another great conversation on Women Talk. Join us for our next episode on Women Talk, discussing menopause on September 21st at 12 p.m. Thank you again to our guests, Dr. Hawkins and Shay, for taking the time out of your busy schedule to share your expertise with us. We'll see you next time on Women Talk.
Thanks for joining us for this episode of Women Talk. You can stay tuned for more Healthy Women Live events at www.healthywomen.org.